Thank you for tuning in to this special edition of Recovery Happens with the Coronavirus. Today's message is not only important for those in recovery, but the community at large, as we speak with the county's expert on the coronavirus, Dr. Mercatante. Dr. Mercatante, thanks for being on Recovery Happens.
Thank you very much.
So we're just going to jump right into it.
Happy to be here.
Thanks for being here. Is there anything we should be taking, such as airborne or zinc or anything to improve our immune system that will help fight off the virus?
Well, that's a great question. And of course, we do want everybody's to be as healthy as possible to fight this off. But literature is very mixed about supplements and vitamins and how well they work. What I can tell you is what we know. We do know that getting adequate sleep and rest can be very helpful for your immune system, as can exercise, regular exercise. You don't have to be a weekend warrior, but going out for a walk and moving every day really boosts your immune system. And obviously a good diet, a diet that's high in leafy green vegetables, especially dark green vegetables and fruits, vitamin C and those kinds of vitamins are also very healthy. So we want people to get their rest, to eat well, and to get out and move every day, obviously with continuing their the social distancing. So rather than going to group workouts, working out online, or going for walks, things of that nature.
What's the difference between the coronavirus and the flu?
Well, it's a different virus, for one thing. The simplest answer is it's a different virus. This virus is a coronavirus. Influenza is an influenza virus. They behave differently. This virus, we don't know exactly how it's going to behave, how it's going to circulate. We don't have treatments for this as we do for the flu, nor do we have yet a vaccine for this. So we're dealing with a whole different animal. As viruses go, though, they are invisible. They tend to be spread when a person is symptomatic, although there is growing evidence to suggest that this virus can also be spread just before you become symptomatic. And so that's, I think, adding to the rapid spread. And of course, the coronavirus, this particular one, is a novel virus. That means we don't have any natural built-in immunity to this as we do with the flu. So lots of differences. People are trying to compare hospitalization rates, mortality rates from this to the flu. And quite honestly, the data is all over the place. And we will eventually be able to look back and compare the two. But right now, I just would think that we're dealing with a completely separate virus that has to be responded to in a different way.
Should we be wearing face masks and gloves right now?
Well, the idea of trying to avoid exposure is extremely important. The best way to avoid exposure is to avoid other people, and particularly other people who are sick. So that's where the shelter in places and the quarantines and all those things are coming from. That is the one thing we know for a fact makes a difference. The virus is spread through respiratory secretions. When somebody's sick and they cough, the virus comes out of their nose or mouth and infects other people. So the idea of wearing a mask if you're sick can help prevent those respiratory particles from spraying outward. But right now, there's really no evidence and nothing for us to think that a healthy person is somehow going to protect themselves by wearing a mask. And there's a couple things that might suggest it might be worse. One is that we have looked at people who wear masks. They tend to touch their faces a lot to fix the mask. And of course, those surgical masks have big gaps on the side. So if somebody's coughing on you with that, it's probably not going to protect you. And the more you touch your face, the more likely you're going to self-contaminate yourself. So the general evidence would be no, you do not need to wear a mask if you're well. And if you know somebody who's sick, it would probably be better for them to wear the mask if there's any potential exposure to other people. The other issue, of course, is that we, as everyone knows, we have a critical shortage of masks. And it's absolutely essential that our healthcare providers and our first responders can protect themselves so that they can continue to take care of you all and the people who need it. And so this idea of allocating precious resources to higher priority needs is something we really have to take seriously.
Sure.
If that makes any sense. If that,
Absolutely,
you know what I mean
doctor.
with that, yeah.
To piggyback off of that, is it okay to go outside? Should there be any concerns about people walking around outside?
Yeah, the virus is spread through person-to-person contact, generally within 6 feet of each other, and usually more than a few minutes. The general rule is 6 feet for 15 minutes. So if you're walking down the street, it's not likely that you're going to be exposed to the virus in any significant way. If you're walking right next to somebody who's coughing, you could be exposed. So it's not the outdoors that's the problem, it's other people. The other way the virus is spread, of course, is somebody coughs on like this coffee table, and then I touch that coffee table and then touch my face. Or somebody who's sick touches a doorknob, then I touch the doorknob and touch my face. So it's not the air outside that's the problem, it's the previous exposure or how close you are to other people. I actually think people will function much better if they get a little fresh air and a little sunshine. It'll make everybody feel a little bit better. But when you go out, be careful. As you go out the door, you know, you touch those doorknobs, wash your hands. Come back in, wash your hands. And that should help.
A very, very, very important message, doctor. What are some of the symptoms one might feel? And if I start to feel one of these symptoms, what should I do?
Okay, so the majority of people have mild symptoms. That means headache, body aches, fever, and cough are the most common. We are seeing reports now of people reporting vomiting and diarrhea, and also some reports of people losing their sense of smell and taste, which are interesting. We don't know how common those are, but any symptom of illness, I would say, is reasonable to consider. As soon as you start to get sick, the first and foremost thing you should do is avoid other people, isolate yourself, because there isn't any one symptom that will tell you, aha, I have this, okay? The only way to know for sure is to get tested. So if you have mild illness and you're just feeling a little achy and you're starting to feel a little tired, isolate yourself, stay home, don't expose yourself to work or any other places, and make sure you stay home until you've had 3 days without any kind of fever or symptoms, without Tylenol or Motrin. So 3 days of feeling well, or 7 days from the first day your symptoms started. Okay, whichever comes first. So we want people to stay home for a long enough time, feeling well, to know that they're not still shedding the virus. And you can do that whether you know you have COVID or not. Right now, we're still having difficulty with testing, and they're prioritizing the testing for people who are really ill or very fragile. Sorry, that's my train going by. But in general, even if you're not sure you have COVID, treat yourself as though you have COVID and protect your people, protect your community and your loved ones by doing that isolation procedure. Now, if you're sick and you're staying home, and generally this infection is mild the first week for almost everyone. Those who recover, which is the majority of people, will recover after that in the second week. Those who are going to have more serious complications start to feel worse in the second week. Now, this is not a hard and fast rule, so I don't want people to say, oh, it's not the second week, I'm not going to do anything. Generally, if you're feeling worse, you need to call your healthcare provider. You need to call your doctor. Almost all of our doctors now are doing teleconferencing and video conferencing to talk to people who have infections to see if they need to be evaluated. You know, we still have sinus infections. We're still getting strep throat. We're still getting flu. And so it's important that you talk to your doctors in case something else would be warranted. And then at that point, you follow your doctor's recommendation. Okay, one more thing. If you are getting really sick and you've been advised to go to the hospital or get better medical care, we want you to call 911 or call the hospital if you're driving yourself and tell them that you're coming and that you have, in fact, signs and symptoms of an infection. That way your healthcare providers on the other side can prepare themselves and make sure that not only are they protected, but make sure you get the right care as well.
Great message. Thanks, Doctor. Do you have a message of hope for those in recovery? Or could you share a message of hope for those?
Yeah, the recovery community.
Go ahead. Sorry.
Oh, I lost you. That's all right. No, I was thinking about that when you asked me to come on the show, and I thought the recovery community is such a powerful message, because we're really asking people throughout the country, really throughout the world, to do something unprecedented, which is really take one day at a time, to take hope and comfort in every day that we have, not looking back, trying to not look forward, because the future is unknown and the past is gone. And I think that's a message that the recovery community has already embraced and is really uses on a day-to-day basis. So I thought that in some respects, the recovery community has, in a way, a skill that they can share with other people that's important for people to learn and to use right now. This is a difficult time. It's fearful, it's frightening, it's a struggle. And everybody has to learn those tools of taking each day at a time, finding comfort in simple things, finding comfort in just the fact that, okay, today I'm okay, and today my family's okay, and making sure that we stay with that message. So I want to embrace that and hope that the recovery community can share that skill with everyone. I also want to make sure that the recovery community is taking the precautions of isolation, or self distancing very seriously. I know how much many of you rely on meetings and support of each other, and that's great. It needs to continue, but please not in person. Please not in person. And I know BW Rock has started posting meetings that can be done online. We're all doing this virtual connection. It has to be enough right now. Do not put yourself or your loved ones at risk by going to meetings in person. I really want to stress that. Take care of yourselves in a way. It's the same way you've been, but you need to be careful about going to meetings with other people.
Great and powerful message there. If you're looking for online meetings, visit bwrock.org and click on resources, and you'll see a tab right up at the top that says local online meetings. Doctor, it's really been an honor to have you on the show today. One of the most experts in the area on the coronavirus, Dr. Mercatante. Really just a pleasure and an honor. Thank you for taking the time to be with us, to share your input and share your message of hope that we're here. We're made for this. Those that are restoring their lives one day at a time have the tools necessary to overcome this.
Thanks for having me. Anytime. And make sure you thank your healthcare workers. They're the heroes on the front line.
The unsung heroes. We can't say that enough. Thank you, Dr. Mercatante.
Unsung heroes is right.
Yeah. We're just grateful to have you and grateful to have all the healthcare workers.
We're going to do great.
We are. We're going to get through this.
This is a wonderful community. It's a wonderful community, and we have great people like you and lots of people working on this. We're going to be fine. Keep the faith, be strong, and together we're going to get through this. Thanks. Thanks for having me.
I love the powerful message of coming together and uniting. Great. Thanks for being on, Doctor, and we'll talk to you soon. Keep the faith.
God bless, Pat. Take care.
Bye-bye. Thank you for tuning into this special edition of Recovery Happens. If you or someone you know is struggling with addiction, please give us a call at 888-68-BWROC. We'd like to thank our sponsor, Tusha Bulba Productions.